Hi everybody, I'm Freya. So glad to have you here as part of the Let's Manage Endo program. We're so excited to be kicking this off the ground and providing you with some really tangible, valuable tips to be supporting your journey on your way to either your diagnosis or your investigations with your medical practitioners. So I am Freya Lawlyer. I am a bachelor qualified naturopath and nutritionist, and I specialise in the areas of endometriosis, reproductive health and fertility. Largely, a lot of my experience as a naturopath and a younger woman has been one of that you'll all be very familiar with, growing up with pelvic pain, going through the typical standard investigations and not really quite getting any answers. So it wasn't actually until a few years ago that I received my own diagnosis of adenomyosis after many pelvic ultrasounds and many consultations with health practitioners. So along the way, especially since I became a naturopath, I'd been trying out all sorts of things. I have a very curious nature on myself, seeing what worked and what didn't, particularly in the realms of pain management, living with adenomyosis, which really certainly transfers to those with endometriosis and even chronic pelvic pain to some degree as well. So I wanted to let you know that all of the information shared today is a culmination of evidence-based tips, clinical tips that I use with my patients one-on-one in clinic every day, but also tried and tested interventions that I have used on myself with good success. So I've picked my 3 top interventions for you today to help support your pain and just your overall health living with endometriosis or adenomyosis or chronic pelvic pain or whatever is happening for you. And these interventions I have chosen are ones that are very readily accessible. They are lower cost. They do come with a little bit of a cost, but they're certainly lower cost to some other interventions. And hopefully these interventions are really quite complementary for you, alongside all of the other amazing advice that you'll be getting within the Manage Endo program. So there'll be beautiful advice on nutrition and movement and yoga and breath work and nervous system support, and the list goes on from a host of incredible practitioners. So I wanted to give you just a few extra little tips on supplementation and some at-home castor oil packs to support you on your journey. I personally use these interventions frequently, as do my patients, so I'm excited for you to get started. So let's get into it. First and foremost, we're going to start off with castor oil packs, what they are, how they work, and how to do it. So first and foremost, you might have heard of castor oil packs. There's a lot of information on the internet out there. There isn't a huge evidence base behind castor oil packs for pain management. However, they have been used for years and years and years, and clinically, we have a lot of evidence to show that they are very, very successful when they have been used consistently. And that's really the key to a lot of my recommendations today, actually. I have a lot of patients and even my family members, my partner, my siblings, where they come up to me as a naturopath and they go, "Oh, Freya, what have you got for this? And what have you got for that? What can I take for this?" And, I'll sort them out with something and then they'll go away, and then I'll check in on them in a few weeks or a month, or I'll go home, especially to my mum's house, and I'll see, a bottle of supplements still 3/4 full. And I think a lot of people have the assumption that, oh, I'll just take a little bit of this just in that pain window, or, oh, I felt a little bit better after I took it and I didn't sort of finish the tub, or I took some of the tablets, or I tried the castor oil pack once or twice, but I didn't find it to be very effective. So my advice is always, depending on what you're experiencing, and specifically today, we're really talking about pelvic pain, endometriosis. These conditions are very much chronic in nature. So it's really important, we can't really assume that these interventions are going to work after the first time you take them or the second time. The key is really to be as consistent as you possibly can. And I, can say hand on heart that particularly my patients with castor oil packs, which we're about to speak about now, those that are really consistent with them are absolutely the ones that see the most profound changes in their period pain, their flow, their reduction in clotting, and even an improvement in their gastrointestinal function. I like to be quite straight up with my patients about the realities of what you might expect from these interventions. And I think realistically, you know, doing this once or twice, it's just not enough when we live with a chronic condition. We want to be as consistent as we possibly can. So let's talk about castor oil packs. So castor oil itself is extracted from the castor bean, and it's extracted into an oil. So it's very reminiscent of, say, like an olive oil or an almond oil or something like that. It's been, as I've written here, used therapeutically in lots of countries for years and years and years as an intervention for all sorts of different things. But the purpose that we're using it for today is the castor oil, which I'll take you through the instructions in terms of how to apply it and what it does, but it is absolutely fantastic at improving blood flow to the uterus and to the reproductive organs. Now, this is very much a traditional Chinese medicine angle in terms of relieving stagnation and menstrual pain and congestion and clotting, but also helping to relax the muscles around the uterus. So when we have our period, I always speak to my patients about, we need to think about how the menstrual blood actually comes out. And one of the methods that the body so magnificently uses is this contraction of muscles that surround the uterus. And really we want the muscular contraction to be like this, just really flowy and lovely, not jarring and crunchy and throbbing and awful like so many of us feel. The castor oil itself can be really beautiful as a muscular relaxant and to help decrease the spasm of the muscle around the uterus during menstruation, which is amazing. The little evidence that we do have about castor oil is that the castor oil itself, we know that about 30% of the ingredient profile of what we apply to our skin will get absorbed into the bloodstream. We have one really great piece of research showing that around the abdomen, when the castor oil is applied with a heat source to help penetrate that oil through the skin, is that it can improve the local immune environment. And for me, this is really interesting in the sense that endometriosis, we know, is a chronic inflammatory condition. It's driven by estrogen and it has significant immune involvement. So if we can be helping to modulate and improve the local immune system around the reproductive organs, which is where typically, not always, but typically the endometriosis is located, that's totally fantastic. And then on top of that, we can be helping relieve that stagnation, the clotting, improving blood flow. And improving blood flow doesn't necessarily mean that you will have a heavier period. It means that with improved blood flow, we can have more oxygen and more nutrients coming to that site where inflammation is to help calm it down. So it's really, really exciting for a pretty straightforward intervention that's quite accessible. The main thing is you just want to try your best to be consistent with the packs. And I'll take you through how to do that now. So what you'll need is, I've written here, you'll need a wool flannel or a cotton cloth or an old t-shirt. So when I did my first castor oil pack, I couldn't really find anything, but I had these beautiful old, like vintage linen kind of placemats that I'd never used before. So they were new, unadulterated. So I used one of those. And you'll also need an old towel, and you know, an old towel that's fine to get oil on because oil does stain. This part's important. You'll need to get your castor oil. Now, I always recommend you get an organic castor oil in a glass bottle. This is really very important. I speak about this a lot. If you're using a plastic tub or a plastic bottle, especially with endometriosis, we're trying our best to reduce environmental toxins and especially things like xenoestrogens and microplastics and things like that. So when we're, you know, using a therapeutic intervention, we want to make sure there's no nasties in it. So dark glass bottle, organic if possible. The bandage isn't completely necessary, but as I take you through it, you sort of understand how it might be helpful, particularly if you want to be moving about while you apply your castor oil pack. I really would just recommend that you take a breather and you apply your castor oil pack perhaps while you're reading a book, watching TV, meditating, or just relaxing. But the bandage can be quite helpful just to secure the pack on your abdomen if you wish to be moving about whilst you're doing it. Importantly, you also need some source of a heat. So this could be a heating pad, could be a hot water bottle, or a wheat pack. Now, I will just make one comment here about hot water bottles. It is absolutely essential if you use a hot water bottle that you are replacing your hot water bottle every year. I've had far too many patients with awful burns because they haven't, or unbeknown to them, they've been using their hot water bottle for years and years and years. So I'm now really strict about talking to my patients about replacing a hot water bottle every year. And that is the advice from the Melbourne Burns Unit at St Alfred's. Which I have learnt through my patients who unfortunately have experienced burns. So please make sure you're replacing your water bottles annually, or ideally just get a wheat pack or a heat pad, which is personally my preference. So essentially what you want to do, I'll just sort of summarize what's written here, is you get your castor oil, you pour it over your flannel or your cloth, whatever it is, and you saturate that flannel until it's soaking with oil. You then wring it out as tight as you can so it's not dripping, just like you'd wring out a wet tea towel. Get a little bit of the castor oil, apply it to your abdomen. Make sure you've got dark track pants on. Really important. I've made this mistake myself. Light trackies, you will probably get an oil stain on the top rim there. So make sure your track pants or whatever you've got on are darker. Rub the little bit of oil on your abdomen and then apply the flannel directly to your abdomen. It's not dripping, remember, because you've wrung it out tight. And then you put your heat source on top, whether that be your heat pack, your hot water bottle, or a heating pad. And you want to apply that for about 30 to 60 minutes. It's sort of as simple as that. A lot of people talk about castor oil packs. Oh, it's a bit annoying because it's a bit messy. The reality is if you've got dark trackies on, once you apply the flannel, it's not dripping or anything. So it's not terribly messy. I mean, if you've got a gorgeous couch and you don't want to get any oil on it, pop a towel down just to prevent any stains and things like that. But once you've kind of got the hang of it, it's really straightforward. So lay down on your back, apply the oil to your tummy, the flannel, and then the heat pack. And then it's your time just to sit back and relax, watch TV, read a book, or whatever you'd like to do for 30 to 60 minutes. When you've used that flannel, you actually reuse it, which is fantastic. So if you've really soaked it, you'll probably get at least 5 to 6 to 7 uses out of it. You'll know when the oil's sort of running a little bit dry in it. You just store that in the fridge, and then when you're going to do your heat pack, you pull it out, leave it for about 30 minutes or so, depending on the climate, just to warm up so you're not putting something freezing cold on your tummy. And my advice is, with regard to the frequency, is in the lead up to your pain window is ideal. So if your pain window is just during menstruation, try your best to do this 2 times, maybe 3 times within the luteal phase of your menstrual cycle. So after ovulation and before your period, if you have a natural cycle. If you're on a hormonal contraceptive, it would just be sort of in the 10 to 7 day lead up to your period. Now, a couple of important things. I don't recommend using castor oil packs if you have an IUD inserted. Just with that heat and the oil, we don't want to dislodge anything. The other thing is if you experience very heavy menstrual bleeding, please don't use the castor oil pack on that primary heavy bleed day. So that for a lot of people, that's day 1 or 2, but you can use it on the other days of your bleeds. Otherwise, there's no contraindications here. Unless you are trying to conceive, please only use the castor oil pack in the follicular phase of your menstrual cycle. So that's from the beginning of your period up until ovulation. Have fun with it. You've just got to give it a go, and consistency is key. I have had patients that I have worked with who haven't really brought in too many other interventions, who have reported a significant reduction in menstrual clotting, in particular because of the improved blood flow around the local region, and a reduction in pain, which if we can even reduce that pain a little bit, reduce our pain medication use, improve our quality of life for a really simple intervention where ultimately you are forced to relax because you need to sit down, watch TV or read a book, which is, something that we all need a lot more of. It's a really worthwhile trying out this intervention. Get onto YouTube. There's so much information if you want just a little bit more sort of hands-on visual picture of how to do it. And there's so many stories of success and people's good experiences with it. There's really nothing to lose. Also, extra little tip, if you tend to experience slower bowels, it can be quite good to help keep things moving. So that's castor oil packs. Have fun with them and enjoy. Next intervention here is magnesium, which has got to be one of my favourite nutrients. Magnesium is utilised in about over 300 enzymatic reactions within our body. So you can imagine it's pretty essential to our daily function. But specifically why I'm recommending it for you today is for its antispasmodic action. So we spoke about before the muscular contraction around the uterus that helps expel the endometrial lining, which is ultimately our period and our menstrual blood. That muscular contraction really requires a decent amount of magnesium to have a nice, smooth muscular contraction. So magnesium is really fantastic at relaxing the smooth muscle, which can have a direct impact on the experience of our period if we are magnesium deficient. Also, absolutely fantastic for our nervous system and sleep. And it can also help with bowel motility, so the rate at which matter moves through the digestive system and out through the poop. It's also an absolutely key ingredient in our energy production pathways. So I don't know anybody who experiences endo, adeno, or chronic pelvic pain for that matter, who doesn't need to be saturated in magnesium. Now in Australia, our soils are unfortunately quite deficient in magnesium for a number of different reasons. It's a little bit tricky to rely solely on magnesium from our fruits and vegetables these days, especially if we have a chronic health condition and our nutrient demands are a bit higher, and especially if we are under a lot of stress. Because when we're stressed, for lack of a better term, we chew through our magnesium at a much higher rate. So it's a really safe intervention, safe if you're trying to conceive, safe if you're on other medications. There really are not any contraindications for using this therapeutic, which is why I've recommended it for you today. So best thing to do is if you're seeking out a good magnesium supplement, I always get these questions of, I don't know which supplement to choose. There's so many out there. If you're not working with a health practitioner, such as a naturopath or a dietitian or an integrative GP, and you're going to seek out your own magnesium, best thing you can possibly do, say if you go to Chemist Warehouse, is look for these different types of magnesium. So the citrate form or the magnesium amino acid chelate forms are really good, reliable, well-absorbed forms of magnesium that can significantly help with all of the benefits I've just gone through. Be sure to just check the back label. There are some more poorly absorbed forms of magnesium which we want to avoid. So just try your best to stick with these two types, and that will help inform which supplement you purchase. For the dose, 400 to 600 milligrams daily is an evidence-based intervention for both nervous system support, muscular relaxation, improving bowel motility, and increasing energy. You can do this in divided doses if you wish, or you can just take this dose of an evening if it's easier for you, and you'll probably get a bit more of the sleep enhancing effects when you take it at night. It comes in all sorts of different forms, powders, tablets, whatever you prefer. It's safe to take with other medications and other supplements as well. Now, just remember the key is with magnesium is to be consistent. One bottle probably isn't going to make a huge difference if you've been experiencing chronic pain, stress, and poor sleep for a really long time. I often say to my patients, if they're starting something new, give it 8 to 12 weeks, be really consistent with it, and you should really start to be seeing the benefits after that. If you're deficient in magnesium, imagine you're sitting here. Through 8 to 12 weeks of supplementation, we then bring you back to baseline here, which is your body's baseline needs for magnesium. And when you get to that point, hopefully you can maintain those levels with your diet and you do not need to supplement with magnesium ongoing. For my patients who do experience chronic stress, anxiety, really poor energy, very chronic pain, they might be better off taking the magnesium ongoing or just during their pain window after that period of time. It's really case by case basis, but if you're feeling fantastic, you can't really overdose on this one. So I hope you enjoy the therapeutic effects of magnesium. My other favourite, another very, very safe intervention with minimal contraindications, is digestive enzymes. So I'm sure we've all heard of endobelly. I'm sure, we all know that feeling of getting the period and the, belly just protruding, feeling really, really uncomfortable. It's really tight and just so bothersome. That might just be during menstruation or during the period, or perhaps you have an IUD, or perhaps you don't have a period and you still experience that awful endobelly or bloating, distension, gas, high levels of food reactivity and things like that. Digestive enzymes are amazing. Are they addressing the absolute root cause of what's happening? Look, in some cases, yes, in some cases, no, but they are a fantastic safe support with minimal side effects to improve your quality of life and get the bloating down until you can sort of do some further investigations in terms of what the cause is. So digestive enzymes, once again, when you're going to purchase a digestive enzyme formula, I've included here the most important enzymes to make sure are in the formula. These are really common, so any digestive enzyme formula will likely include these ingredients. So just pick one that looks, reputable, maybe have a look at some reviews online. And the most important thing with digestive enzymes that I find where individuals don't see a good improvement is they're following the dosage on the bottle, which of course is typically what we would do. But if our digestive system is really under functioning and it's really under producing digestive enzymes, meaning it's very hard for us to break down our food, absorb it, the food starts irritating our gut, we bloat, there's excess fermentation, there's gas and things like that, we do typically need to go to that upper end of the dose. Once again, digestive enzymes have a very good safety profile, so you can feel quite confident trying the upper dose of the 2 capsules of the enzyme with your breakfast and the 2 capsules in the evening with dinner. If you've got chronic sort of gastrointestinal symptoms or bloating, 1 tablet a day is just not going to cut it. So try that upper end of the dose and you should really start to see an improvement within days if the digestive enzymes are working with you. So once again, try your best just to be really consistent with the supplementation to see the best outcomes. They're really, truly helpful. And for some individuals, if it's just the tummy troubles that they have during a pain window or during the period, you might find that just bringing in the digestive enzymes in that window is enough for you. But if you do experience chronic sort of gastrointestinal symptoms across the entire cycle, taking them consistently can also be really helpful. So good luck with tracking down some castor oil, which you can purchase online. Health food stores have it. Health food stores also sell the magnesium and the digestive enzymes as well. Otherwise, Chemist Warehouse is usually pretty reliable and they tend to have some good options as well. I hope you have enjoyed this presentation and I hope in some way one of these little tips will help you on your way to managing your endometriosis. You are more than welcome to reach out for me on my website, freyalawlyer.com.au, or follow me on Instagram if you would like any further support on your journey. But I wish you all the very best in health and hopefully connect with you one day soon.